Good afternoon, I'm Dr. Alexandra Molinares and I'm family medicine physician and physician owner of Valera Med Spa. I've been practicing medicine for the past 19 years. I'm so excited to talk today about a great topic. People are always tired about looking at themselves. They look tired all the time. They're thinking about how can I improve my under eye area. It looks dark, it looks puffy, or it might look sunken in. So you always look tired and you wanted to get rid of that. And you have tried probably so many creams, so many different options for puffiness, for dark circles, fine lines, and you can't find a solution. But today I'm going to be talking about fillers that are used for these tear trough areas. The fillers that most commonly we use are like Restylane, Versa, and those are much finer fillers that we can introduce into that area. But you have to be careful. You have to really do it with a physician that is really expertise into and feel comfortable about doing it and feel that area. You just need a very small amount of this product that is introduced with a microcannula. I always recommend to do it with a microcannula to do multiple things. One is going to be minimizing risk for bruising, risk for vascular occlusion, which is a very important complication that can happen with any fillers that are injected with a straight needle. The microcannulas have a blunt and flexible tip that are introduced a little bit below from the area of the tear trough. We don't inject the filler right at the area anymore at all. Ever since I've been started using the microcannula, I have never had anybody else having any bruising at all, which with a straight cannula, minor bruising was happening, but never something serious. And with some arnica gel, you know, and ice, it will definitely was something that it was improved over a few days. But with the microcannula, you don't have to worry about any of that. The amount of filler that is introduced with a microcannula are really micro doses, little bit by little bit in each specific area. We are able to just have one incision point right below this area, and the cannula are passed through the different tissue area all the way to the tear trough, and we are like drawing back and forth until we fill out that area. We can blend the product much easier, and once that is completed, the person is really had no discomfort. I do the procedure using a topical numbing, triple anesthetic. That way the procedure is very comfortable. But really it's just one incision point that doesn't really have much than a tiny bit of blood. Once we put pressure on the incision point, there is not really even risk for bruising in that area at all. You can put some arnica at home, some ice for home care use, and that's pretty much totally it. So now you don't have to worry anymore about this procedure. Everybody is so scared about filling up that area, and you don't have to be worried about anymore, because just with a small amount you are able to get that area under the eye fully stretched, fully covered, and you don't look tired anymore. It's a really life-changing. Everybody that have done it nowadays with me here in the spa, they are so comfortable. They are having like this moment of like increased self-esteem. They don't look tired anymore. So everybody was asking you at some point whether or not you are like having slept, lack of sleep, you are having that area soaking in all the time, dark. But over time, that area gets improved even more. Over a period of 3 to 4 weeks, you can see that when the product expands into that area, how the area even looks even better. I always recommend to do a small amount. You can, usually what I do is I make you to come back in 2 weeks if we need to add extra product into the area. That's even better than put too much and be overfilled, and then you are needing to have that filler to be dissolved, because then you're going from sucking in to be overfilled and then look puffy. So we don't want that. So as long as you do it with a professional like me, a physician, then you should be in good hands. We use the micro cannula. Just to recap, access point is just one. Minimum discomfort with the triple anesthetic. Really no downtime. You might get 1 or 2 days, maximum 3, or some swelling underneath the area, but no more than that. You can apply the arnica over the area and eyes for home. Always sleep in your back. Make sure that you always sleep in your back, because when you're sleeping your sides or face down, then you are going to cause more swelling on the area, and for the recovery period is not a good idea. And even for further, if you try to sleep on your back, you can minimize that area pressure or anything like that. Other things to consider also is make sure that you stop all anti-inflammatories, aspirin, Motrin, Aleve, fish oil, and multivitamins, mainly if it has liposoluble vitamins like vitamin D, K, A, and E. Those are the ones that help you to increase more risk of bleeding and perhaps some bruising. So we wanted for you to stop those medications at least 3 to 5 days prior to the treatment. Some people might even need 7 days prior. If you are taking anticoagulants and you can't stop it because of medical reasons, I need to make sure that your doctor is okay for you to have the procedure done. So that's pretty much it with this treatment. It's really easy, and you don't have to be afraid anymore. So if you wanted to schedule a consultation, make sure that you give us a call back at 813-695-4051 at Alera Med Spa. You can also follow us on our Instagram and Facebook at Alera Med Spa. Thank you for watching.
La cierro, porque no me gusta cerrarme eso. Estaba pensando era para que se viera esto acá, ¿ves? Ponemos bien esta de acá y esta ponerla así, ¿cierto? 1, 2, 3.
At 813-48, oh my God.